Part 1. Trust became the weak point. Public health systems depend on trust in ways that are easy to underestimate. Not blind trust, and not perfect trust, but enough confidence that people believe guidance is given in good faith, decisions are explainable, and errors are acknowledged rather than obscured. In the United States, that foundation weakened long before any recent crisis or political figure. It weakened quietly, through everyday interactions that felt small at the time but cumulative in effect. Most people did not stop trusting healthcare because they rejected science. They stopped trusting it because the system became harder to understand, harder to navigate, and harder to believe was working in their interest. Complexity without clarity. Healthcare in the US is genuinely complex. That complexity is not itself the problem. The problem is that complexity is often presented without translation. Insurance documents describe coverage in terms of tiers, codes, networks, and contingencies that are difficult for even attentive readers to interpret. Changes are communicated through dense notices that explain what is happening without clearly explaining why or what it means in practice. When plans are canceled and replaced with alternatives that appear nearly identical, except for higher premiums or different cost sharing, people are left with terminology rather than understanding. Over time, repeated experiences like this create a sense that explanations are designed to satisfy requirements, not to inform. That gap matters. Cost as a trust erosion mechanism. Trust is also shaped by predictability. Few things undermine confidence faster than discovering the true cost of care only after it has been received. Surprise billing, opaque pricing, and inconsistent coverage rules train people to expect uncertainty. Even when care is technically available, the fear of unknown cost changes behavior, delaying treatment, avoiding follow-ups, or disengaging entirely. This is not an ideological response. It is a rational one. When people cannot anticipate consequences, they stop believing assurances. Institutions that speak poorly under pressure. As systems grew more complex, institutional communication often became more defensive. Language shifted toward legal precision and risk avoidance rather than clarity. Explanations became longer but less informative. Mistakes were corrected quietly, if at all. Accountability was diffused across agencies, insurers, providers, and administrators, each technically accurate but collectively unhelpful. Over time, this creates a vacuum. When institutions struggle to explain themselves, others step in to explain for them. What happens? When trust weakens. When trust erodes, several predictable shifts occur. Expertise must compete with confidence. Repetition begins to substitute for evidence. Personal narratives feel more credible than institutional ones. Individuals become symbols for entire systems. None of this requires malice or conspiracy. It is how people adapt when clarity is missing and stakes are high. By the time a crisis arrives, the groundwork has already been laid. The public is primed not to evaluate guidance on its merits, but on whether it feels consistent, confident, and aligned with prior experience. Signals to watch. As this series continues, it helps to notice a few early indicators of trust strain. Explanations that grow longer but clearer on none of the practical details. Language that emphasizes compliance without understanding. Corrections that appear quietly, without acknowledgement. Complexity that increases without improving outcomes. These signals often appear well before policy consequences become visible. Why this matters going forward. Health policy does not fail all at once. It frays. Trust is usually the first strand to weaken, not the last. Once it does, every subsequent decision, no matter how well-intentioned, faces skepticism, resistance, or distortion. Understanding how that erosion occurs is essential because it explains why later debates become less about evidence and more about narrative. That is where the series goes next. Next, when expertise became personal.